From Mr. Jones' medical record, I definitely want to look at oxygen saturation in particular because he's a patient who is in acute respiratory failure. Oxygen delivery is super important just in general, but now we're about to mobilize him, which is going to require more oxygen delivery. So I definitely want to check that is over 90% just to be safe. Other vitals like blood pressure or heart rate. I also want to look at what his trends have been with his vitals. So even with oxygen, is there a lot of fluctuations that may make him not tolerate mobilization very well or to be unsafe? What have they been? He's been on bed rest for 5 days, and that could challenge his cardiac system. So it's just important to look at those. I also want to know what other lines, leads, and tubes they have him on that could interfere with mobilization. I want to know what medications he's on. Medications could have adverse effects and change his response to mobilization. So, for example, he might be on pain meds or other heart rate or blood pressure medication, which may alter or suppress his heart rate response to mobilization. So that's important to see. He might be on antibiotics, which may just change the way he's feeling. I want to make sure he's feeling okay to move around. He might be on blood thinners or something since he's at risk for a DVT with being on bed rest, which would increase his risk for bleeding. So whatever meds he's on, I want to know how that could affect mobilization. I think it's worth looking at his lab work. So just checking hemoglobin, making sure that he can transport enough oxygen with his hemoglobin count, checking his hematocrit, which tells me about his red blood cell count, which may interfere with what his energy levels are, and looking at like body temperature and white blood cell count just to see if he has any sort of infection lingering from the pneumonia or something else from the hospital. And then I may also just want to look if there's any notes about observation from how Mr. Jones has been doing, how he's feeling, how he responds to things from the nurses, what is his emotional state, what have they noticed about his level of consciousness, things like that, just so I can see kind of what those trends are going forward as well.